This video introduces a clinical hypothesis for rule-based risk stratification in living donor liver transplant, or LDLT, developed by Dr. Sharad Maheshwari, MD. The risk assessment considers many factors, including donor age, BMI, steatosis, anatomy, and social support. Recipient factors like MELD and FLR percentage are also analyzed. Additionally, the risk assessment looks at caregiver support, insurance status, and psychiatric evaluation. The hypothesis utilizes 4 indices. The Volumetric Safety Index and Recipient Reserve Index assess physiological feasibility and recipient tolerance. The Donor Technical Complexity Score addresses operative risk. Finally, the Socio-Demographic Risk Score ensures post-transplant sustainability. These combine into the Donor-Recipient Pair Safety Score, or DRPSS. The domains are weighted to reflect clinical focus. Donor technical complexity is the most critical at 40%, followed by the Recipient Risk Index at 30%. The Volumetric Safety Index accounts for 20%, and the Socio-Demographic Risk Score is weighted at 10%. The Donor Volumetric Safety Index, or VSI, has critical failure penalties. An FLR below 30% results in a 50-point penalty. Steatosis greater than 30% also constitutes a critical failure, incurring a 40-point penalty. The Donor Socio-Demographic Risk Score, or SRS, includes penalties for ethical instability concerns. Major psychiatric concerns and lack of financial or social safety each result in significant point deductions. Major anatomical penalties are factored in, with significant deductions for complex portal vein and arterial anatomy variants, multiple outflow reconstructions, and challenging biliary anatomy. Surgical modifiers, or SCM, apply penalties for short stump lengths in the right hepatic vein and portal vein. Other penalties include small hepatic artery caliber and multiple biliary stumps. The only positive modifier is a bonus for a reconstructible IRHV. The engine uses weighted domain synthesis to align with the 40/30ths/20/10ths power balance. Each 10-point drop in a domain removes a specific number of points according to its weight. The next scenes further explain the concepts in the LDLT risk assessor. The hard stop contraindication logic involves nonlinear scoring. Any critical failure, such as a GRWR less than 0.6 or FLR less than 30%, caps the entire score, regardless of other favorable factors. The scoring penalties are consensus-inspired severity penalties, derived from how transplant teams already escalate concern in discussions. The score is a communication scaffold, prioritizing transparency over accuracy. The goal is to label patients as high risk, not to reject donors outright. The creator notes having assessed over 500 liver donors on CT and MRI. Thank you for watching this video. For more information, please visit the Liver Donor AI website.